Hi, today I'm going to talk about osteoporosis. It's one of the leading disease processes that affects millions of Americans, both male and females in the United States. Most of them affected are postmenopausal women, usually after the age of 50, and men as well over the age of 70 mostly. Osteoporosis is basically, and simplified, is the weakening of the bones. So the cells that build and break down your bones are overactive, so your bones get weakened over time. Part of it is a little bit of the natural part of aging, and of course there's some things that we can do and genetically that affect it. It does affect more women that are lower in weight, so meaning like less than 20 or 19 of a BMI, and also Asian women are a little bit more prone to than compared to African American women. Our biggest screening test for osteoporosis is called the DEXA scan, which is a bone density test. And usually that is done where they look at the thickest bone in your bodies, meaning your leg bone and your hip bone and your low back bones. And usually that screening test is done for women above 50 and men above the age of 70. Well, the first thing is with lifestyle, we want to make sure you're not drinking too much caffeine or alcohol. Do weight-bearing exercises, so that way you can strengthen the bones, because as the muscles pulls on the bones, that helps strengthen the bones. And also there's a couple medications out there that help build the bone back up. Some of those medicines are oral and some are injections as well. If you're postmenopausal, 5,000 units of vitamin D3 daily, as well as around 1,200 milligrams of calcium, because vitamin D helps calcium absorb in the body. And then in addition to that, you can do the oral medications. And we speak about it for women a lot, but it does affect men too. The studies are mixed, but the men over the age of 70 should consider it too, because osteoporosis leads to hip fractures, and that's the leading cause of death in elderly patients, and we want to prevent that if we can. Definitely reach out to your primary care doctor, super important. During the annuals, I ask all my patients who are around the age between 45, 55, between there, I definitely ask, because if they have a family history of it, that's a big risk factor in their lifestyle. Around 50, or if they've been postmenopausal, meaning no cycles for a year, we can start the screening for it. And then from there, we screen every 3 to 5 years. So I wouldn't wait.